very, 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 very important to... Hi everyone, welcome back to my channel. Thank you for tuning in. Before we get started, make sure you go ahead and subscribe to the channel. Go ahead, quit playing, everybody subscribe. Okay, so we're gonna get into it. We are gonna talk about oral health, and that is. So let's jump right into it. Our mouths are very, very important. They are where things enter and mostly bacteria start. So that's, your mouth is like the beginning of everything. So you want to always make sure you take care of it. I'm gonna start with some important tips that you could use to make sure you always have fresh breath, clean teeth, and just overall good oral health so that we're not offending anybody. First, I'm gonna start with, as soon as you wake up in the morning, you need to be brushing your teeth. You need to brush. Waking up and the first thing you're doing not be brushing your teeth is unacceptable. You need to brush, brush, brush. The type of brush that you need to use, or that is the best, is a soft brush or either a child's brush, small, so that you can get smaller areas. Use a soft toothbrush because it's just better for your teeth. You're not injuring your gums while you are brushing. So a soft toothbrush, and if you want to use a child's toothbrush, even better. The next thing that you want to do is have a tongue scraper. You can purchase these anywhere, Walmart, Amazon, anywhere you can purchase a tongue scraper. And this helps get the bacteria off of your tongue. Important. So you just use it. It has soft bristles on one side, and then the other side it has more coarse bristles if you want to use which either side suits your fancy. So I love this thing, it's great. Make sure it gets all the bacteria off of your tongue. So the next item I'm going to talk about is a tonsil stone remover. It also lights up. My light is dimming. I don't know, it's acting weird. But anyway, it's got a light on it. Our tonsils are back in our throat. If you open your mouth up and use a bright light for this, you'll see, if you have your tonsils, if you didn't get them removed, you'll see two things on either side of your throat. They look like spongy tissue, if you will, on the back of your throat. And sometimes, not everybody gets that, but most people with tonsils will get tonsil stones. So tonsil stones are calcified debris that get in the pockets of your tonsils if you have tonsils that have big pockets in them, or that just acquire things. And they're white and they do not smell the best, and you might wonder what they are. Those are tonsil stones. So you can purchase a tonsil stone remover on Amazon, or you can use a long Q-tip and just gently push back there, gently, to express the tonsil stone. Like I said, not everybody with tonsils gets tonsil stones. Some people do. If you do, this is a good instrument to have to remove them, and it's got like a little spoon on the end, so you can just reach back there and scoop it out if you have that issue. Once you scoop out that tonsil stone, I would gargle with some warm salt water, or maybe a little bit of diluted Listerine to help keep the back of your throat clean. And the next thing I'm going to talk about is mouthwash. So a good mouthwash to have is something with fluoride in it, or whatever you can tolerate. A lot of people cannot tolerate really strong mouthwashes like Listerine. It's a pretty strong one. Personally, my favorite is the nasty yellow Listerine, because I feel like it just is killing those bacteria. And it's also, I've noticed when I'm starting to get a cold and I have a sore throat, that Listerine always seems to make my throat feel better quicker, because it's killing the germs back there. Germs, bacteria cause sore throat. But anyway, a good mouthwash to have is something with fluoride. There is a Listerine that contains fluoride in it. That's good to have. Fluoride keeps our teeth nice and strong. And Listerine. So I've seen a lot of patients and their mouths are peeling, and they've wondered what that peeling is, and it's their tissue pretty much just being stripped by using a too strong of a mouthwash. So use something gentler if you have peeling, or that skin just, you notice after you brush and use your mouthwash. If you see that happening, then you probably need just not so strong of a mouthwash. Very, 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 very important to floss. Please floss. Yes, when you do not floss, it seems like a hassle, it's a pain, but once you make it a habit, it's actually part of your whole oral dental regimen, and it's easy to do, and you just know that that's part of it once you get used to it. Floss. It is very, very, very important to floss. It helps getting those interproximal decay that happens in between the teeth, also called kissing decay. You want to floss. You eat something, you don't floss, it sits in the middle of your teeth and it starts to just go bad and eat away at your teeth. You do not want that to happen, so you need to floss every day, morning, nighttime. If flossing twice a day is too much for you, make sure you at least do it at nighttime after you have eaten and you're getting ready for bed. You do not want to go to sleep with that bacteria in between your teeth and on your teeth. So floss, floss, floss. I like to get the fluoride flossers. You'll read it, and I think it's made by Dentex, and they have fluoride on the floss, so that way the fluoride is making your teeth strong in between, as well as getting that bacteria that likes to hide in there out. So you want to make sure you are flossing before bedtime and brushing, doing all of that before bedtime. You do not want to sleep with sugar and just bacteria on your teeth that it just can eat away at. Another important thing is a lot of people seem to not know what calculus is. Calculus is a white, thick, hard material that is bacteria, pretty much, and it builds up on your teeth, and it just eats away at everything, and it causes just nasty stuff to happen. So when you start to notice that stuff building up on your teeth, it is unacceptable to say that you are afraid of the dentist. It is a fear to go to the dentist. This is your overall health. You need to get that bacteria off, and you need to see a dentist on a regular basis. You do not want to have calculus just sitting on your teeth. You need also have a mirror that you can look at the back of your teeth. Make sure that everything's looking good and that you're good. When you brush in circular movements, and you gently massage your gum. Do not rush hard. Gently massage your gum with your toothbrush. Get the back of your teeth. Don't forget the back. Listen to your dentist. They are the dentists. They went to school for what they do, not you. So stop trying to argue with your dentist or self-diagnose yourself. Some dentists are out there, I will admit, are up to no good, but use your intuition when you are looking for a dentist. Most of them are good ones, and they have an ethical code to abide by. So just listen to them and follow your gut instinct with them, and you can always get a second opinion, no matter what it is in life. If you're seeing a regular doctor, a dentist, or whoever it may be, somebody fixing your house, whatever, you can always get a second opinion to make yourself feel better. So just listen, believe in your dentist. Hopefully you find a good one. It can be tricky, I believe it, but yeah, so be good to your mouth. People will appreciate fresh breath. So in conclusion, brush with a soft toothbrush. First thing in the morning, scrape your tongue, check your tonsils. Also, by the way, if you do notice a tonsil stone back there that you just can't get, don't mess with it too much, because you can definitely make your tonsils bleed and irritate them. So if you have to leave it, leave it. If you get a lot of tonsil stones, more than usual, you might want to talk with your dentist or doctor about your tonsils and see what their recommendations are. Floss, your mouthwash, soft toothbrush. Don't be gross. Keep your teeth clean. Important. I believe that concludes our video. Thank you for watching. Make sure you like, subscribe, and tune in next time. Bye. That you can Hi everybody, welcome back to my channel. So today we are going to talk about oral health care. Cat. Where was I? Oral health care, that is, get your mind out of the gutter,